India spends less than 2% of its GDP on healthcare, and the COVID-19 crisis is set to expose serious fault lines in the nation's health infrastructure.
The largest worry with corona is not necessarily just the impact of the disease itself, but the healthcare system getting crippled.
On March 25th, when Prime Minister Narendra Modi announced a nationwide lockdown, it precipitated a humanitarian disaster. Scores of poor and hungry migrant laborers fled from cities, many marching to their villages by foot.
There are people dying of hunger. There are people desperate for some food.
Can India contain the evolving humanitarian crisis, even as it fights the COVID-19 pandemic?
This is a sight that history will judge. This is a sight that we will never forget in this country.
I've never slept with a mask on. But I did last night.
A contact tracing message triggered a rapid chain of events for Akansha Sood, a resident of Noida, Uttar Pradesh, situated around 50 kilometers from India's capital, New Delhi. Suspected to have contracted the coronavirus, she was asked to report to the Ambedkar Hospital in Noida, where her nasal and throat swabs were taken.
It was a 3-storied building, so every floor had about 6 bathrooms. And trust me, in the 1.5 hours I was waiting over there, I went to each and every bathroom, and none of them were usable. All of them were dirty. There was not enough water. The doors wouldn't latch. They were broken. There was poop in every pot. And I wasn't comfortable using the bathrooms.
Akansha, mother of 2, was asked to be in the quarantine facility for 2 days till her test results arrived. And then the doctors would decide on a further course of action. But what followed was just the beginning of a prolonged nightmare.
I was taken into my room, and it was quite a shocker because it looked like it hadn't been cleaned, and the bed sheet and the bed cover, the pillow and the blanket that were lying there didn't seem to have been changed.
I spent quite a terrible night. I barely slept. On and off, I just drifted in and out of sleep.
Yes.
My older one, my daughter, she understands to some extent as to what's happening. My son doesn't. And the more they talk to me, the more this, why aren't you coming home? Why aren't you coming home? To just hear my kids ask me, why aren't you coming home? I can't explain to them why I can't come home. I can explain it to my daughter. I can't explain it to my son. And while I was there, I kept thinking, I'm never going to see my children again. I'm never going to get out of this place alive. And I'm never going to see my family again. What if I've had the infection? And I'm an asthmatic, and I honestly don't know how it affects asthmatics, but I kept thinking if I've contracted the virus, I might just be here, and if something happens, what if I'm really, really seriously ill? When am I going to see my kids again?
It was a long wait for her swab results. Her stay at the hostel extended beyond the 2 days that she was asked to be there. With over 100 samples drawn every day for testing, slow turnaround times were an issue at the time of filming for this documentary. The hostel had not been equipped to safely house the increasing influx of people crowding around and waiting anxiously for the test results to arrive from a lab in Aligarh, nearly 120 kilometers from Noida.
I have today, I have probably tomorrow, and if my report doesn't come by tomorrow evening, then probably day after.
If I'm not positive, definitely standing here even for these 15 minutes is going to make me positive, because again, there were about 12 people there, all coughing, sneezing, shouting, screaming. It just kind of broke me down, and I went back to my room and I kept crying. If nothing else, I definitely have got the virus.
The COVID-19 pandemic is exposing serious fault lines in India's health infrastructure. As a country that spends less than 2% of its GDP on healthcare, and where over 90 million households live in one-room homes, India faces a daunting challenge. The sheer size of India's population may make it hard for resources such as test kits and protective gear for health professionals to reach every corner of the country.
I do think that our testing has to continue to scale up, right? So as we see more and more cases, and as we see COVID cases grow, we're right now doubling in every 6 days. Our testing has to at least double, ideally grow by a larger multiple, possibly 3x in those same 6 days, so that we can identify things earlier, before they become a large challenge, before they become large new sources, so that we can fight it with open eyes.
The number of tests has been going up. It's been going up quite rapidly in the country, given that we started from a baseline of doing very few tests a day. We have amplified on a log scale. The adequacy of testing is something that we will be able to assess more clearly after the fact than in the midst of trying to ramp up to as much as we can possibly do.
A day before India declared a 21-day lockdown, Akansha took a midnight flight to Chennai to pick up her kids who were spending time with their grandparents. Unbeknownst to her, boarding the same flight on March 24th were followers of an Islamic missionary movement, Tablighi Jamaat. It would be the start of what would turn out to be a vicious and targeted attack on the country's Muslim community. In the first week of April, India reported 1,445 infected people with a common link. They all attended a congregation at West Delhi's Nizamuddin Mosque. According to government data, 30% of the total COVID-19 cases spread across 17 states were linked to the Tablighi Jamaat.
If the people, those who have traveled to India, would have been checked up at airport and they would have been quarantined at airport, then definitely this disease would not have been spread up.
State governments launched a massive search to trace people who had come into contact with them. The incident triggered widespread Islamophobia and anti-Muslim rhetoric, with large sections of the population accusing Muslims for bringing the coronavirus into the country.
The point is, no matter how stupid, no matter how irresponsible any one particular sect of any particular religious group is, you simply cannot use that as an excuse to begin to target everybody.
This was absolutely the responsibility of the government. If the people would have been stopped from coming to India in the beginning itself, like that was done by the Saudi government on 28th of February, so in India also the flights would have been stopped from coming to India.
COVID-19 will play itself out in every country differently. It will play itself out according to the existing social, political, and economic landscape that it finds itself in. What you're seeing with the anti-Muslim bigotry and hatred that has reached epic proportions in India is partly to do with all the xenophobia that arises at the time of a life-threatening pandemic raging in our midst. But it is also a reality that India already had this hate in its environment.
Over 2,100 foreigners entered India in early March. Experts say that the central government delayed its pandemic response and that the Tablighi congregation happened before it announced any restrictions of movement. Urging unity and brotherhood, Prime Minister Modi stated that the disease does not see race, religion and colour.
The media illegally, maliciously has projected this illness as Corona Jihad, as Corona terrorism. This illness or disease has not been originated from Wuhan, but from Tablighi Jamaat Markaz, Delhi only. The media, in fact, openly persuaded people to hate Muslims, to take actions against Muslims, not to allow Muslims to enter in their streets, not to allow Muslims to enter in hospitals.
I mean, there are like a lot of news channels which were just regularly, repetitively trying to bring in hate amongst people. Being a healthcare professional, the patient for me is a patient. I would take care of him with all my heart. The community needs to grow out of this now. It's really important for us because the more we are united, the more forward we can go.
All the irresponsible, shameful media channels, as far as I'm concerned, each of them is guilty of hate crimes. Each of them is guilty of promoting hate speech. And at this time, at a time when there is a health pandemic, when our people are starving, we need to stop this hate. We need to stop this bigotry because we have far, far greater crisis that we are confronting.
As India fights COVID-19, it confronts another crisis unfolding on the nation's streets, one that needs to be tackled just as urgently as the pandemic itself.
ऐसी व्यवस्था ना करें जहां जैसे लोग कह रहे हैं कोरोना वायरस तो बाद में मारेगी, पहले भूख हमें मार देगी।
ध्यान से सुनिए, पूरे देश में आज रात 12 बजे से संपूर्ण देश में संपूर्ण लॉकडाउन होने जा रहा है। हिंदुस्तान को बचाने के लिए, हिंदुस्तान के हर नागरिक को बचाने के लिए, आपको बचाने के लिए, आपके परिवार को बचाने के लिए आज रात 12 बजे से घरों से बाहर निकलने पर पूरी तरह पाबंदी लगाई जा रही है।
On March 25th, India entered a 21-day lockdown, a drastic step for a nation that had a little over 500 COVID cases then. The Prime Minister's speech triggered a mass exodus that saw scores of the country's poorest fleeing their cities, many marching to their villages by foot. Every year, millions of workers migrate from rural areas to find work in large cities and send money back home. But now, the lockdown has triggered a human catastrophe, with almost all these workers losing their jobs, leaving them completely broke and hungry.
You have to recognize the lived reality of people. About 40% of our population in urban India live in slums, which are very, very congested. They don't have access to adequate water and soap and all of that. So you have to make sure all of that was provided. Even now, what is most urgent today is food. There are people dying of hunger. There are people desperate for some food.
With transport halted within hours after the announcement, hundreds of thousands of migrant workers were stranded on the roads and highways, while more than 20 died walking home to their villages.
I think the Indian government has displayed enormous lack of sensitivity. It's like they did not recognize that 90% of our country works in the unorganized sector. There are an estimated 100 million migrant workers in our country. And before any kind of lockdown, and you must remember, India was given a 4-hour notice. The Prime Minister announced it at 8 p.m. By 12, the lockdown was in place. We ought to have given people the opportunity, the humane option of being home in their own villages with the security of their families.
The lockdown has disproportionately hurt marginalized communities who lost their livelihoods almost overnight. To mitigate their hardships, the government has announced a total of $264 billion stimulus package. According to Prime Minister Modi, this is equivalent to 10% of the country's GDP. As part of the stimulus, around 800 million people will receive 5 kilograms of free grains for 3 months, while pensioners and farmers will receive direct cash transfers. Activist Harsh Manda welcomes the government's move, but feels that the poor need more support during this crisis.
तो इसमें सिद्धांत और नियम गरीब और अमीर के लिए बराबर का होना चाहिए। हम लोगों को अपनी तनख्वाह सुनिश्चित है, घर में जगह है जहां पर हम साफ रह सकते हैं, हाथ को साफ रख सकते हैं। अगर सरकार को इसको लागू करना था तो पहले दिन से यही सिद्धांत लागू होना था कि हर जो मजदूर पेशा इंसान है उन्हें जो मिनिमम वेज है, न्यूनतम मजदूरी है, उसके हिसाब से वेतन मिलना चाहिए रोज़ अपने घर में।
Muhammad Ashad was only a few months old when his parents came to Delhi 8 years ago after selling the house in Bihar. Ashad was born with a congenital abnormality. The hope for treatment brought the family to the city. But today, they are jobless and penniless and have fallen by the wayside.
हम चाहते क्या तो परवरिश करके आ जाए, पढ़ लिख के कुछ बनना चाहता हूँ, पुलिस बना दो, स्पाइडरमैन बन जाऊँ, कुछ भी बनना चाहता हूँ। तब
पढ़ने का बहुत शौक है, मगर मजबूरी है इसकी कि स्कूल में दाखला नहीं हो सकता।
Ashad's parents were construction laborers before the nationwide lockdown stripped them of their work. Their contractor still owes their daily wages of around $120. They were evicted from their home in a slum nearby as they were unable to pay the rent.
ठेकेदार ने एक पैसे नहीं दिया सर, बहुत परेशान है। बच्चे सब कोई कुछ मांगता है, कुछ खाने को या इसके इलाज तो चल रही, जब से पैदा हुआ है जब से तो डॉक्टरी और दवाई पे ही चल रहा है, इतना बड़ा देख।
This is a sight that history will judge. This is a sight that we will never forget in this country. That this is how we have treated the workforce. This is the backbone of this nation. How can we not provide? How could we not have thought about them? How could we not have made assurances of either immediate food, immediate shelter, and primarily immediate transport? Why could we not have given a little bit of notice to ensure that this mammoth tragedy we are seeing unfold on our streets did not happen?
कोरोना वायरस से संरक्षण का तो सवाल दूर दूर तक नहीं है इन लोगों के बीच में। और एक बात जो बार बार आपसे भी मुझसे भी कई साथियों ने बेघर साथियों ने बोला कि कोरोना वायरस तो हमें पता नहीं आगे मारेगा कि नहीं, लेकिन उससे पहले हम भूख से ज़रूर मर जाएंगे.
On a positive note, many organizations are offering relief to the poor. Janta Razoi used their cloud kitchens to prepare and distribute meals to the needy. But there is risk of increased infections among these communities where social distancing is hard to achieve. For instance, the population density in Delhi's slums is nearly 30 times that of New York City.
It is extremely difficult for them to maintain social distancing because there are multiple people in one room, and if one person is coughing, he is bound to spread the virus to multiple other people that he is sharing his accommodation with. Also, the vastly populated country that we are, it is very difficult to trace the contact.
Added to this is the strain to medical facilities that a large outbreak risks causing. Currently, almost all suspected cases of coronavirus are referred to government hospitals, where the abysmally low availability of beds can complicate the problem. Ajit Mishra, an economist and a previous cardiac patient, travelled from the UK to Delhi in mid-March. He developed cough and light fever. While he was waiting for test results, he had to stay for 4 days in Delhi's Ram Manohar Lohia Hospital.
Ram Manohar Lohia, not the perfect conditions. The staff obviously was very nice. The nursing staff and other helpers, they were nice, but I don't think it's designed for this kind of purpose, for a proper isolation ward, because you have common washrooms and no shower facilities and things like this. But so it wasn't the best hospital stay you would imagine.
After he tested positive for COVID-19, he was fortunately moved to a much better facility, Safdarjung Hospital, where he stayed for nearly 15 days till he recovered.
It's not so much the physical illness which was the key thing, but it's the psychological. The way the media have been reporting, the number of deaths, the number of infections, and stuff like this. So that kind of builds in a fear element. But after 4 or 5 days or into a week, into the hospital stay, you start realizing that the worst part is over. I mean, I won't call it hype because it's not a hype, it's an actual thing. People are dying and people are suffering. But I think we have probably overemphasized the negative complications associated with COVID-19.
For Ajit Mishra, COVID-19 is not a death sentence.
Stop worrying about things which you cannot control. And don't even start playing scenarios saying, oh, if I'm going to test positive, then this is what's going to happen. So that's not helpful. So just the idea is to take your mind off it. Those who have tested positive, the first week or 10 days, well, then, listen to the doctors, listen to their statistics, that more than 80%, it's mild symptoms. Maybe another 10% you will need an oxygen treatment. And it's the very last 10% that you need to probably go to the ICU. So there is a very small chance that, you will be serious, no doubt. We should all be careful. But I think there is too much of panic somehow.
As of May 13th, the number of infections are close to 80,000, with 2,400 deaths and over 24,000 recoveries. Though infections are considered low for a country of India's size, experts say that testing needs to get aggressive. The Indian Council of Medical Research, or ICMR, has conducted over 1 million tests so far and is looking to double its testing capacity to 100,000 per day by the end of May.
I think the imposition of the lockdown was a large step. A country of 1.3 billion people, I would give credit to the government for having taken such a large and bold step reasonably early. There are areas where the government should have probably thought more, done more. Some of these details in micro is where India could have done better. One of the macro steps that I wish we had done better is just how we've approached testing. Testing in India is controlled by ICMR, and ICMR has been, I would say, somewhat slow in opening up what kinds of tests should be allowed.
I think the plan that has been articulated is quite clear. There is guidance for who should be tested. There are additional plans for large clusters, and those are being implemented at the moment in places that have a concentration of cases. So I think strategies have been developed and have been put in place over the last few weeks. In many places where these strategies have been implemented, we are seeing that control of infections, the number of new infections, is decreasing.
With India entering into an extended period of lockdown till May 17th, the country's districts have been divided into red, orange and green zones. Red and orange zones with varying levels of restrictions are where infections are reported and increasing, while green zones are safe areas where COVID-19 has been contained. One such zone is the city of Deoria in Uttar Pradesh, India's most populous state with over 200 million people. The administration, headed by Rakesh Patel, has efficiently tracked down over 10,000 people with a travel history, quarantined over 1,000 people, and stopped all intercity travel.
सबसे पहले तो जो लॉकडाउन का आदेश हुआ उसको हम लोगों ने इन्फोर्स कराया बहुत अच्छे से, और जो होम डिलीवरी की हमारा सिस्टम था उसको बहुत अच्छे से इंश्योर कराया कि चीज़ें जो भी हैं ज़रूरी बेसिक एमिनिटीज़ हैं डेली लाइफ के लिए, उसको हम डोर टू डोर हर मोहल्ले तक पहुंचाएं, गांव में भी शहर में भी. इसकी वजह से लोगों ने कोऑपरेट भी किया.
One of the quarantine centers is located at Deoria Government Hospital that caters to over 3 million people. During the lockdown, a 100-bed maternity ward was turned into an isolation ward. At the time of filming, more than 80 patients were under quarantine here.
As a doctor, हमारी पहली प्राथमिकता होती है कि हम अपने मरीज का ट्रीटमेंट करें. डर तो सबको लगता है, ठीक है, क्योंकि एक ऐसी बीमारी है जिसका कोई इलाज नहीं है. हम लोग जो सेवा कर रहे हैं और जो समाज में एक जागरूकता ला रहे हैं कि आगे इसका कैसे बचाव किया जाए, जिस तक किया जाए.
Currently, among the districts in Uttar Pradesh, there are 19 red, 36 orange and 20 green zones. But beyond medical support, patients require adequate psychological support and empathy from doctors.
It was a task, a mission that we were given, because when you're isolated from everybody for so long, you don't have anyone coming to see you. And what you see, what the kind of people you see are, wearing all those scary protective gear. Anyone would have, things going on psychologically that wouldn't be, that healthy for them.
But the psychological health of Mumbai's famous Dabbawalas is taking a huge toll as the lockdown has upended their lives, with many among them facing starvation. The Indian government that initially ordered a national lockdown for a 21-day period has extended it till May 17. It's a brutal blow to those who work at the informal sector, which includes many street vendors as well as taxi and auto drivers. The impact will be huge because this sector employs approximately 85% of all workers.
So you can't say, I won't let you work, I won't let you procure your own livelihood, but I won't give you any livelihood either. It can't stay that way. I think this needs to be thought through much more carefully. And what worries me is that I don't see a game plan with the government, either in terms of ensuring supply during the lockdown. They said we're exempting the supply of necessities, but that's not the same as ensuring the supply of necessities.
With almost all workplaces switching to work from home in India's maximum city, Mumbai, the iconic Dabbawalas or lunchbox carriers have taken a hard hit, with many among them staring at starvation. The world-famous and much lauded food delivery system engages nearly 5,000 Dabbawalas supplying home-cooked food to around 200,000 office workers across the city. This is for the first time in the Dabbawala's 130-year history that they have had to halt operations. Vilas Maharaj has been a Dabbawala for nearly 20 years now. The lockdown has not just disrupted his work, but has wrecked his livelihood.
तसेच महिन्याची आमची जी इन्कम आहे ती अगदी थोडी आहे. 10 ते 12 हजार आमची इन्कम आहे. त्यापासूनच आम्ही आमच्या संपूर्ण कुटुंबाचं संरक्षण करतो, त्यांचं पोट भरतो.
On March 19, the Dabbawalas suspended their services in light of the COVID-19 crisis. Vilas managed to return to his hometown to his family of 6.
तसेच आमच्याकडे कोणत्याही प्रकारची बचत राहत नाही, कारण आमचे मासिक जे उत्पन्न आहे आणि आता लॉकडाऊन असल्यामुळं आमची जी जीवनशैली आहे ती खूप अडचणीमध्ये आहे.
Vilas is now waiting for the day he might be able to go back to the city and resume his work. Until then, he and hundreds of fellow Dabbawalas have to live a hand-to-mouth existence.
आणि मी वेळेत पोहोचलो, पण गावाला गेल्यानंतर खायचं काय त्या ठिकाणी असा प्रश्न उद्भवतो आणि ते प्रश्न वेळोवेळी वाढत गेले आणि वाढलेल्या लॉकडाऊनमुळे खूप अडचणी वाढू लागलेल्या आहेत.
The lockdown will substantially disrupt the operations of small, medium and micro enterprises because of their dependence on the cash economy and demand and supply side shocks. There are challenges getting raw materials transported on account of the lockdown. These enterprises contribute to about 30% of India's GDP and require adequate policy measures for a bounce back when economic activity resumes.
Our medium, small and micro enterprises were already in bad shape. They were already in decline, with many failing every day. This is like a death blow. It will take years for them to recover, even to the levels that they were at last year. It's an unbelievable, devastating impact. And I don't know what this will mean, because they account for all of the employment practically. Less than 3% of our workforce is employed in large-scale companies and enterprises. So it's very, very worrying what is happening to small and medium and micro enterprises.
Smita Singhal founded Absolute Water, a clean tech company that provides turnkey solutions for converting waste into clean water. The company provides safe and clean drinking water as per WHO standards. With headquarters in Delhi, the company has installed 14 toilet-to-tap wastewater treatment plants across the country.
Most of the plants for which we have the contracts, they are currently running, because now being a sewage treatment plant, you can't really shut sewage off. Because if you shut sewage off, it will overflow and it will, kind of leach into the ground. It will get into the toilets. It will get into your kitchens. So the whole pipeline is designed in such a way that it goes through the plant, gets treated, and the treated water comes out, and then the treated water is used for various purposes, everything from horticulture to toilet flushing to AC water cooling to washing maintenance in whatever way they need to use, and substitute water which they normally get through the supply chain. So in terms of that has not stopped.
But the staff face difficulties reporting to work owing to lack of transport. So the treatment process has been significantly disrupted. The plants may have to be overhauled before work resumes.
To come there, obviously nobody can go there because of the lockdown. Especially breadworms that we have been able to develop over the years for all our plants, they will die for sure because they have no sustenance coming in. And due to that, we would be needing to rehaul an entire plant and that is going to cost us a lot of money to do that. So we're trying to figure out how to, in this under this lockdown period, what we can do, or what help that can we sort out from the client in order to at least start running this plant maybe 2 or 3 hours in a day, so that that moisture content and everything is maintained.
Apart from the logistical issues, new projects and contracts have been put on hold, and this is a huge blow to the company.
As per our financial calculations, we may get into a loss. We can only ascertain that once the whole lockdown period gets up and industry starts moving, transport starts moving, that we're able to get some of our material in, and really we can ascertain that then. But from our current financial calculations, it will definitely be a loss for us. If I have to consider the number that we made for the last financial year, this coming financial year, whenever we get back to work, it will be a 60% of a loss for me this year.
The outlook for the informal and micro, small and medium-scale industries remains dismal. The drastic measures of the Indian government may have resulted in flattening India's COVID-19 curve. But there's a catch.
So I think when you look at what is happening with this virus and you look globally, there is an asynchronous spread. When was the virus introduced? Where has it spread? And where are you seeing clustering of cases? So in large countries, spread is never going to be something where you will have a single wave passing through. It's going to be different stages in different places at different times. So your control measures that you develop have to be calibrated to the stage of disease that you're seeing in a particular place.
On April 20th, more than 50 journalists in Mumbai city tested positive for coronavirus. Despite the risks involved, the call of duty beckons many of these journalists as they venture out to shine light on stories as they unfold.
15 districts in Uttar Pradesh state have been completely locked down, and there's a lot of panic out here.
Gurmit Sapal is the editor-in-chief of Swaraj Express, a 24-hour Hindi news television channel.
Namaskar. Pravasi mazduron ki dukhon.
He has had to change the way he works during the lockdown period.
सामान नहीं मिल रहा? सामान नहीं मिला फिर क्या ना? जो स्टॉक है वो यूज करेंगे. चलिए ठीक है बहुत.
With no access to the studio because of social distancing measures, he is understaffed.
So I'm outsourcing the operation of this big camera to him.
Gurmit has deployed his son to operate the camera while he's away reporting from the field. He often depends on his reporters, but is now compelled to think differently out of concern for their safety.
नमस्कार, मैं हूं आपके साथ अनिका। आज कोरोना वायरस की मार हम पर चौतरफा पड़ रही है।
There were a lot of issues in that. Whether the reporter will follow all the safety protocols, that's one thing. Another thing is the reporter cannot go all by himself. You'll have to send a camera person with him, a sound recordist with him, because we are not clipping anyone, and we need a boom. We don't want to touch anyone. So what I thought was that instead of sending a 3-member crew, it is better that I go along with my trusted, friend and a camera person. Some 20 days into the lockdown, I realized that a lot of people, a lot of poor people, they are locked in small pockets where social distancing is just not possible, and they don't even have masks or sanitizer or even basic soap to basically clean their hands and all. There is like one toilet and one bathroom for 50 people, and these are the people who are highly vulnerable, and the government aid is not reaching there. And being a news person, being a media person, there was an inner calling that these stories need to be told, their hardships need to be told.
But there are positive stories that need to be told as well. What stands out in India's response to COVID-19 is the containment strategy adopted by the South Indian state of Kerala. The state's people-centric health system has had prior experience managing the Nipah virus outbreak in 2018. On January 30th, Kerala reported the country's first case, and though the numbers began to spike by early March, the state has been able to contain the spread so far. By putting in place a system of home delivery of food for those who cannot step out of their homes, and by taking special care to feed and house migrant or guest workers, as Kerala calls them.
They put in place measures for contact tracing very, very early, and were able to follow up, identify people, get to them, check up on them on a regular basis. I think right now the rest of the country is following that model because that model is one that makes sense. We have to try and do the best we can with the tools we have and keep making sure that we are improving.
The law enforcement officials have won praise for their media campaigns to spread messages of hand washing and social distancing. The police officers have been working round the clock to ensure people stay indoors, while at the same time taking safety measures to protect themselves.
We did a lot of digital intervention, mainly for two different things. One, for raising awareness on the coronavirus itself, saying that how this virus spreads, what all safety precautions you need to take. So this was intended both for the police officers and for the general public also. And because we made those videos in a very innovative way, in a very creative way, it had a great following. And then secondly, we cracked down on all the fake news also that is coming up. So that also we cracked down on a big basis with the social media intervention.
But noteworthy is Kerala's innovative approach, the epic levels of contact tracing, surveillance and isolation that helped flatten the curve.
We came out with certain innovations like the TeleMed app, where we connected a lot of doctors along with the startup company so that anybody sitting at home itself can get medical advice.
Some of the other states like Orissa, Chhattisgarh and Rajasthan have tackled the crisis well. But there's a concern.
The largest worry with corona is not necessarily just the impact of the disease itself, but the healthcare system getting crippled, which is what we saw in Italy, and even New York was at the brink, but has been able to fight it and come back. But in India, the largest risk that we run with our inadequate healthcare capacities is that if our healthcare system were to get burdened, then that would be a very large risk, and it might increase the fatality of this pandemic, possibly manyfold.
It's a healthcare system challenge that prolonged filmmaker Akansha's stay at the hospital. She was waiting for almost 5 days for her test results to come through.
On the morning of my 5th day, my husband was running pillar to post from between the district magistrate's office and the chief medical officer's office, trying to figure out, how we can get access to the report. And that's when I put out a post on social media asking people if anyone on my list could help me figure out where my report was, because it had been day 5 and I wasn't in a very safe place.
I just want to bring all of them back.
But luckily, Akansha tested negative. After isolating herself for 14 days, she's now back home.
My first 48 hours outside the quarantine facility were a nightmare, to be honest. I just couldn't get a grip of myself. I couldn't sleep. I kept thinking, every time I'd close my eyes, I kept thinking I was back in that place, and all I could hear was people coughing, especially at night. The stillness here just got to me.
In March, India was one of the first countries to impose heavy travel restrictions, banning international travelers, including suspending most visas and eventually stopping all international flights. The medical journal Lancet says that the lockdown is already having the desired effect of flattening the epidemic curve. What's critical is that the lockdown that will last till May 17th has bought time for India to prepare for what's to come.
Well, infections are rising, but the ICMR data suggests that the infections are rising at a slower rate, which is what everybody wants. But remember, this is just kicking the can down the road. The point about a lockdown is that you have to prepare in that period. It gives you breathing space as a government.
Even as it fights COVID-19, India has to concurrently address the evolving humanitarian crisis. The good news? The Food Corporation of India has a surplus of nearly 100 million tons of grains that can be distributed to the poor.
I think the announcement that they would release 5 kilograms per person free, that was a step in the right direction. Immediately, the central government should transfer this to the states with the provision that please make this available free, 10 kilos per person. So there should be a system of temporary ration cards for 6 months for this period. And the central government should provide a minimum income, a basic income for at least 3 months to all the people who've lost their jobs.
The world's largest democracy is particularly vulnerable to disease outbreaks because of its huge population. But history shows that it can be surprisingly resilient. The rate of infections is considered low at this point. But it may be too soon to tell whether India is an outlier, as infections in the country are expected to peak in June or July.
Our human immune system is an absolute marvel. This is being projected as, the world is going to end. The world is not going to end. The absolute numbers look really large because our populations are big. But the important thing to remember is most people who get infected will get well. So this is serious. It must be taken seriously. But I think we need to arm people with accurate information about where we are today and where we are going.
And this is not a crisis to be wasted, but rather needs to be viewed as an opportunity. With COVID-19, there are big lessons for India.
Our healthcare budgets are small. India's healthcare budget is about 1.5% of its GDP, and that needs to go up. I think we have to invest more in our healthcare infrastructure. Public health and public education need to be very high quality. India has ignored them. India has assumed that private healthcare and private education is what is top quality, and we've almost given up hope on public health and public education being top notch. And I feel that attitude has to change. I hope this is a wake-up call and we can change that.